everyone, it's James Hamill here again, owner and CEO of Chorus 3D and Clinical Director of Chrome UK and Ireland. So thank you very much for opening the next installment or video of the Chrome release to the UK and Ireland market. I hope you have enjoyed the last couple of videos. The information has been useful to you, and certainly from the response there is quite a bit of interest. So what we're going to answer today is, when is Chrome appropriate? When would you use it? What patients? And just give some information around that in the next couple of minutes. So essentially we're looking at case selection. So there are two main groups of patient that we are using full arch immediate load treatments for. And the first of that, and arguably the biggest group, is those partially dentate patients. So these patients often present with a broken down arch or arches due to caries, periodontal disease, a mixture of the both, infection, breakdown, maybe a whole host of failing restorations, or indeed perhaps a partial denture with a few remaining straggling teeth. And the decision is being made as to what is the long-term treatment options for this patient. Do we stage them down a treatment to dentures? Do we stage them through implants? Or do we take the jump into full arch implant based restorations? And whether or not we are going to immediately load those. So this group of patients are challenging and they require a good bit of thought, but they do make up the biggest number of the Chrome cases out there. The second group is the edentulous, which are arguably the more difficult to treat from a surgical perspective. And these are those cases that have been potentially wearing loose, uncomfortable dentures for a long time. They've had enough. They want to improve function, appearance, confidence, and implants are really their only route to be able to do that. They often present with a bag of dentures, and we have to try to provide some solution for them if possible. Quite often, bone can be a problem, and so they can be challenging to treat and to plan. No matter what case, whether it's a dentate case, whether it is an edentulous case, we have to start at the start. And the very first thing is the importance of records, which I have called the tripod of information. That is made up of three individual elements, and that is photography or photographs to us, models, and the CBCT information. Without all those three being of a high quality, we will not be able to produce for you at the far end, for you and your patient, the quality of work that you want. And the cases will not go through the process. They will be simply stopped, and you will be asked to repeat some of that initial record taking, so that we can ensure that the quality is there, because what we put in is what we're going to get out. So with Chrome we use Preview, which is the smile simulation software. It's very simple and easy to use. You will be able to go via the 3D or Course 3D website to use it, and it is a series of 4 photographs, and it is all on, the instructions are online, PDF that you can follow to give you the information. But the photography is important. The second one is models. We can accept both digital and conventional models, or conventional impressions. Conventional impressions we simply digitize at our end and then upload them to the portal. However, you can also send us straight from your intraoral scanners your STL files. And again, we would ask that these are accurate, that they are clear, that all the teeth, if they are present, are included, the sulcus and soft tissue, so that again we can ensure that the product we produce is acceptable. And the third one is CBCT. It is critically important that the CBCT is of a high quality and that it is taken well, and the patient is not just put in the machine and irradiated without some thought. We do provide instruction PDFs on all of this, especially when we look at CBCT imaging, and this obviously it can be provided to you. It's downloadable on the website. So there are tips and things to enable us to ensure that the quality is there. Once you're getting those records, the next thing we would ask you to do is to establish the vertical height of the patient, that final vertical restorative space that you want, and also to establish the bite. In partially dentate patients, this can be as simple as a local lab producing you some bite blocks or some try-ins, and you take the patient to that point, record them at the vertical that you want, simply send us the models with the bite blocks in place. We will scan and go from there. Sometimes it requires for edentulous patients for you to go to the try-in stage of a new denture or temporary denture. Again, recording the vertical and size of line, center line, all the information. The more information, the better. But it is vital that the vertical and the occlusion is recorded, because we will be using that to work from. Once you have that information, it is then a matter of getting everything online, again through our portal, which we discussed in the last video. But this is simple to use. Jot in all the information. We are available online via the telephone and again through chairside to help you through this. But once you have done it once, it's a relatively straightforward process. Information comes, it then enters through the workflow for you then to end up with your online planning meeting, and the case then goes into production. 12 or so days later, you end up with your Chrome box, which is everything that you need to complete the case. So in terms of dentate cases, the bits and bobs that are in that box are as follows on the screen. And really the reason I'm showing this is to show the difference between a dentate and an edentulous case, and that is in the first upper left hand picture under pin guide. The pin guide for a dentate case uses the patient's remaining existing dentition to help support and locate the fixation base. Once the fixation base is in place, and only when it is pinned in place using the fixation kit, is the pin guide removed. You then remove the teeth and proceed then to bone reduction and contouring, osteotomy guide, carrier guide, the delivery of your provisional, and the pickup of the rapid appliance. With an edentulous, and that is all prescribed for you again in an instructive PDF which comes with every case. With an edentulous case, it is slightly different. The pin guide in this case was a lower full arch against an upper full denture, and the pin guide is held in place in occlusion, and it is very important that this fits well, because that again is holding the fixation base in place prior to it being pinned, and then the pin guide removed and the usual workflow then followed. There are a few things around how you do that. Again, this is covered in the PDFs, but you just need to be aware that there is a slight difference in how that pin guide is used and how the fixation base is delivered in the dentate and the edentulous or the edentate patient. I just want to run over, as we close the video off, some of those advantages that we touched on last time. Remember that there are quite significant surgical and restorative efficiencies for you if you're getting into or do a lot of immediately loaded full arch treatments. You're looking at between 2.5 and 3 hours from local anaesthetic to the provisional bridge delivery versus the conventional way of doing things, which obviously takes most of the day. You do not need technician support chairside for the pickup. It's a very, very simple process, and one, again, all the bits and bobs are provided for you in the kit. It is very possible to do 2 arches in one sitting. You do have reduced stress for the clinician and patient. Obviously, there is a learning aspect to all of this. However, it is extreme. It is almost paint by numbers to a degree, and there is a process there to follow. There is very good information and frequently asked questions, documents which have been produced, and these will be shared with you in subsequent videos. It helps remove the guesswork. So where is that transition line going to be? Remember, planning is mandatory, and the planning has to follow a certain pathway for the case to go into manufacture. You get improved predictability, and very importantly, there are simpler and faster conversions. Rather than having 5 or 6 appointments, taking impressions and fits, this can be done in one conversion visit, and the final bridge fitted the next day or the next visit. There are 2 other things just to make you aware of. For those of you who are doing zygomatic cases, ZYGO Chrome is available using a very clever, what is called catch technology, to help stabilise the osteotomy drill. It is well worth a look, and it is available now, so if anybody wants to know more, just let us know. And finally, Chrome Natural. This is designed for these cases, high lip line cases, highly aesthetic cases, maybe where there's been rampant caries, and a lot of bone removal is not really required or ideally wanted. And this allows, Chrome Natural allows a scalloping process or preparation of the bone to be carried out. It's something that's interesting. It may not be for a huge proportion of patients out there, but it has gone through beta testing, and perhaps it is something that some of you would like to know more about. You just need to let us know. So thank you again for listening. More information as usual, click on the contact us button below, give us a call, or simply pop us an email and we will get back to you. Thank you.